Hello, I'm Dr. Padidar at Minimally Invasive Surgical Solutions in San Jose, and I'm here to talk to you about knee pain. If you have chronic knee pain and are over 50, you may have arthritis. Well, surgery has been the standard of care for many years, but there are many other non-surgical alternatives that we can do here, from simple cortisone injections, gel injections, and nerve blocks, and now an embolization of the knee that is done in the office. It's called Genicular Artery Embolization, which cuts the excess blood supply to the knee that is causing inflammation. This procedure is done in an outpatient procedure. Usually takes 1 to 2 hours without anesthesia or any incisions. It is done through a tiny puncture at the wrist or hips, and a Band-Aid is placed thereafter. Your recovery is fast and you go home the same day. The results are expected to last usually around 3 years, and you're still a candidate for surgery thereafter. So if you suffer from knee pain, please call us at our office for a consultation. Thank you.